Now, over the past few days, the word hantavirus has been making headlines and circulating across social media, leaving many South Africans with questions and concerns. Now, while any emerging health story can create anxiety, health experts say it's important to focus on facts, not fear. Now, hantavirus is not new globally, but for many people, this is the first time hearing about it. Now, so what exactly is it? How does it spread? And what symptoms should people look out for? And how can families protect themselves? Now, tonight we separate fact from fiction and we unpack what the public really needs to know about this. A very good evening. My name is Thabo Molokoane. Welcome to this edition of Soweto Today. Joining us in studio this evening is Steve Mabona, the spokesperson for the Gauteng Health Department, to help us break down what hantavirus is, what the real risks are, and also, to talk all things health and, just get a sense from them. There are plans in place to address various challenges within the health department. Appreciate it for taking the time. Welcome to the show.
Good evening.
Maybe let's start the conversation by just getting an update on, the hantavirus in its entirety. Where are we as a province, and has there been any development?
Look, the development is that our outbreak team has been working hard, making sure that we finalize the tracing of those that would have been contacts to those that passed away. And that process is done. We're at 100% in terms of us interacting with everyone. I know there's less than 5 people that were isolating, and we also still have that case in hospital. The majority of those that would have interacted with, they were actually connecting flights in this country, so they are not South Africans. So that's why you might have seen that the World Health Organization was actually congratulating us to say we managed this process very well. Our epidemiology work, it's well sought, worldwide. Our researchers, our clinicians, we've been dealing with outbreaks and managing them very well. NICD is knowledge into the testing, and our clinicians, they're well sought. So that's how we manage in the country. But that Gauteng is leading because you have 4 academic hospitals in Gauteng.
Yeah.
And as it were, you will then have an understanding that most of the work when coming to health, it's happening here.
I know we've got quite a lot to go through, but I need to understand, there was quite a lot of issues in terms of how this hantavirus is spread across, people were talking about rats, all these things, and then there was some sort of panic, amongst the public. So basically, what is it, just for the layman out there? And also, how can people protect themselves, moving forward?
Look, the research gave us, solace that it's actually difficult to have it here in the country because of the rats that they explained that you get it from rats when you are in close contact. And it happened in the far-flung areas, not even in the country. So that's why we found solace that people had to be calm down, reassure them that we would not have a spread, in this country. There was allegation that in Stibeng there were people. We went to Stibeng and we found that there's nothing like that. But that people want to spread fake news. But in this country, really, there was no need for panic, as it were.
So in terms of, campaigns, we know that obviously now the matter is under control. Was there sufficient, campaigning in terms of, making sure that communities know actually what this is about, because as you said, people have been talking. Misinformation in this regard was actually at its peak. How did you guys manage the spreading the information?
We had necessary graphics that we shared on our social media platforms. We also have a new program under the leadership of MEC Faith Mazibuko that Siabapilisa. We go to communities, provide a basket of services, be it your screening. People need to screen, and you might have seen on Sunday there was a World Hypertension Day that was commemorated, and we had to put more effort to say people need to know whether their blood is not pressured, to the sense that they will be sick, because there's different ailments that will come out of hypertension, though it is termed a silent killer because there's no symptoms. You might just collapse at a later stage, find that you have stroke or heart attack, kidney failure, all those. We encourage people to come and we screen, not only for hypertension, but look at all other ailments. We do vaccination, make sure that we are preventative as much as possible. Your HIV and AIDS testing, your TB, all those ailments that we think they need to be attended to before it becomes too late. That's what we do. So we were sharing that information on hantavirus to say, be calm, it's very far from you, this thing, and it's well managed.
Steve, we're going to take a quick ad break. When we come back, let's get into other matters. We know that, recently you released statements on the NGOs, the payroll controls and disciplinary cases within the department. And also maybe just get a sense from you. I had the MEC, when I spoke to her, the previous MEC, Nomantung Komaralhoko, talking about going digital within the department. Let's get a sense of where we are as a province in this regard. Steve Mabona, Gauteng Health spokesperson, talking to us all things, health, including the hantavirus, as we know that they have the matters under control at this stage. We're coming back after this. Welcome back. You're still watching Soweto Today. We are continuing our conversation with Steve Mabona, the spokesperson for the Gauteng Health Department, as we are unpacking various issues within the health department. Steve, as we continue the conversation, I want us to let's start with the conversation of digitization. We know that the previous MEC, spoke about going digital, especially when you look at files and other things within the various hospitals. How far are we, and how important is this process?
No, this process is quite important, because with the digital work, you're prone not to lose any information. You know that our files, at some point, were litigated. Yeah. It's easy for us to go in the system and get those files. We work very closely with RAF. There's some of our patients that will need that information. When it's digitized, it's easy for you to navigate around it. But also, we've introduced the system on managing the surgeries, where we register people that are supposed to be doing the surgeries. We know the number of them, how many they are, and the system will then say those that are booked. Also, we need to understand how many are those that are booked. Mm-hmm. And out of those that are booked for surgeries, how many cancellations you have. Because definitely you're going to have cancellations. We saw people saying at Charlotte there were cancellations, and putting a lot of perspective on that. But we're saying in an academic hospital, you're prone to have cancellations, because in the event of any emergency, what do you do? As a health practitioner, you prioritize those that need emergency service, at that time. So you can't ignore an emergency because you have elective surgery that you must conduct. All elective surgeries must then be put in abeyance, because then you can reschedule. But the system will then tell you that these ones are cancelled, but then reroute them so that you rebook for those. And those that were done manual, we are working tirelessly to make sure that they're also in the system so that we know in terms of our backlog, where are we? And when we do the marathons on surgeries, we know that we'll be dealing with that backlog. So it's quite key, and we're going to move swiftly in our human resource management as well, because that's where there's leave that is captured, and you don't need paper on leave, it must be in the system, so that you don't pay spooks, you don't pay people that are not in existence. You make sure that you account for all those that you have in the system. So it's a quite a good system to digitize.
So how will that benefit also, just the general public? Because obviously if you go digital from the administrative part, obviously somehow you are dealing with a lot of queues, be it in casualty. Now, what are the plans in terms of alleviating those pressures, especially from casualty perspective? Because most of the people would say that, look, I've been here for hours and then I haven't received any assistance. I still have to go and fetch my file first, and all these procedures that one needs to follow before they can be assisted. What are the plans in place?
We're going to unleash a campaign on awareness, make people understand that primary health care plays a significant role. So people don't need to go to hospitals that are far-flung from them. There's clinics and there's community health care centers that they need to go to. Like, that's why we've announced on those that are applying for disability grant at SASSA. Some don't need to go to a hospital, because when you go to a hospital, there's fees that are scheduled, which are gazetted, that you will be required to pay. But if you are going in a primary health care, it's free of charge. You're not going to be paying anything. And more so, also on those that are chronic, receiving medicine, they don't need to go to hospitals. There's a system that they need to, a centralized system for dispensing, where they need to register, give us the closest center where they can then receive medication. Because if after treating any chronic ailment, after treating for 6 months, moving on, you will then be required to take medication. And if we know where we're going to be delivering that medicine, we will just go there and deliver. So you don't need to go on a long queue in a facility. And, so that's what we're doing now.
For some time you've had a challenge as a department, especially when you look at bogus doctors, within the department. There's recent, in previous years, you've arrested quite a few people that have posed as doctors within the various health facilities. As the department, how concerned are you about, people that are entering your facilities and then, pretending to be health professionals? It's not only doctors. Some are pretending to be nurses and all these type of professions within the health department.
Look, it's more verification more than anything, and tighten our security. That's why it should not be easy for anyone to enter our facility, because you risk the life of patients and our employees. So we are improving on our security. As well, our relationship with the stakeholders who are supposed to be authenticating, certification that yes, this is a doctor, yes, this is a nurse. We're working very closely with them and bringing labor closer to us to say, in the event of anything, you need to allow us to move with the charges or expel people, and also go to those that would have been corrupt in allowing people to be in the system. So that's what we're doing.
So we're going to take a quick ad. We're going to come back. Let's wrap up the conversation, touch on the issue of the NGOs, the pathology services, and also consequence management. I know quite a few officials are also on suspension in this regard. Gauteng Health spokesperson Steve Mabona, as we discuss all things health, and also some of the implementations, particularly when you look at the issue of digitization and, just talking more on the plans in place to deal with the backlog in various hospitals. We're coming back after this. Welcome back. You're still watching Soweto Today. Thank you for joining us. My name is Thabo Molokoane. We are in the final stretch of our conversation with Steve Mabona, the spokesperson for the Gauteng Health Department, as we wind down the conversation. Steve, the issues of NGOs and, the pathology services, maybe just give us an update in terms of the payments first, and also what has been happening in terms of the downing tools there and the pathology services.
No, definitely. We actually paid all our NGOs, most especially your mental health care NGOs, because those are they play a significant role in our health system. The only challenge that we had was about 8 NGOs that were not compliant with financial management, or even SARS. So in that case, that it will be difficult for you to even process those payments. So we've been working very closely with them to say comply so that we can then release those payments. But out of the 8, already 4 they've already submitted. So we're left with the remainder, and we should be in a position to finalize so that then they're paid, and we know that we're not going to be having a problem. But that when we pay them for the entire financial year, so that they can then operate, and because the service level agreement dictates that then they must also submit information so that by the new financial year we know that we have everything, and then we pay for 12 months.
What has been happening in terms of pathology services? We know they had down tools on Monday. Have the services resumed? Because obviously, when services are affected, then other, processes will be affected, especially from that department itself. What is the status there?
Yes, they have resumed yesterday, as it were. And we just want to apologize to the families or the bereaved families that were affected by this, because some it to affect their funeral arrangements. And we actually then committed to say families need to be allowed to collect the bodies on weekend, because normally it doesn't happen. But because the employees, committed that they will work throughout, so we are allowing that to happen. And but it was something that really was not necessary, according to what we think, because the issue that they are raising, it emanates from way back around 2018 or so. They are complaining about the conditions of employment, talking about the positions or ranks. You'll understand that the pathology service was sitting with the South African Police Service before it was transferred to us. So by nature, you will have people that are trained as police, so the contestation around the rankings and all those things. So it's something that we finalize, because it's national. It's not even Gauteng. So we should be in a position to conclude on that matter.
Steve, we're running out of time, but 2 things as we wrap up the conversation. The issue of, vacant posts within the department. Obviously, as a department, you've spoken about this for quite some time, saying that, other vacancies, key vacancies need to be filled, especially when you have acting positions in higher offices within the department. And then also on the middle floor, in terms of the people on the ground, the doctors and other people. What has been happening there? Are we likely to see those posts being filled? And also the issue of consequence management. I mean, some of your officials are on precautionary suspension. How do you, or how will you as a department manage to bring trust back to the people? Because, I mean, people have been complaining about the Department of Health for quite some time now, especially the issues of corruption that we've been seeing for for a few years. And now, what is the comment of the department in this regard?
No, definitely. The vacancies are being filled. I mean, we have advertised so many positions, and the decision has been taken that the CEOs must be permanent, because then you will know that you're going to be stable. The stability was lacking because CEOs would not have an interest of being in a contract for 3 years or even 5 years, because then they know after that they probably not sure about their future. So it was more of a deterrent from CEOs having an interest in filling these positions. That's why you will see most of them are acting. So we agreed that we're going to advertise those positions, but they should be permanent. So we're going to be filling. But we released quite a lot of posts with clinicians, all those that are in line function. We have advertised. So some interviews were facilitated already. We should be filling in different facilities, not only one. I know Tembisa, it's where we were challenged. We didn't have many of your doctors there and other clinicians. So we are filling those positions. But across the province, we are filling those positions. Consequence management, yes, there are employees that are on suspension. But because we are working with external authorities, like for instance, those cases that are sitting with the SIU, we have a dependency there. We can't move, and to a certain extent, if SIU advise that you can't have them in the institution, then definitely we can't be having them in an institution, but working very closely with the SIU to say, how do we then move forward in terms of finalization? But we are dealing with those. Yes, other people are saying it's millions that we are spending on them. Unfortunately, because they are not expelled and their cases are not expedited, they are not finalized, unfortunately, you need to pay them.
Steve, unfortunately, we ran out of time, but let me thank you again. Quite a lot to go through, but we'll definitely have you back on the show sometime. Thank you for coming in.
Thank you.
Steve Mabona, Gauteng Department of Health spokesperson, there helping us unpack all things health, some of the issues that they have, and also some of the solutions that they have as a department in terms of filling in those vacant posts. Now that brings us to the end of today's discussion. Remember to share your thoughts with us. It's current affairs at sowetotv.co.za or WhatsApp us at 081-531-8857. From myself, Thabo Molokoane, and the rest of the Soweto Today team, thank you for watching. Your latest news updates up next. Until then, bye-bye.